The United Nations Secretary General Antonio Guterres landed in Mogadishu to start an official visit to Somalia. Guterres met Somali President Hassan Sheikh Mahmoud and a number of Somali officials. The Somali president thanked the UN head for his historic visit. The UN chief, who previously visited Somalia in March 2017, is due to hold talks with political leaders and visit a camp for internally displaced people. Here is the story.
UN Secretary General Antonio Guterres arrived in Mogadishu on Tuesday to kick off a brief visit to Somalia. Guterres was given a red carpet welcome at the capital airport by Somalia's foreign minister, who posted pictures of the event on Twitter. Somalia has imposed a security lockdown on Mogadishu for the visit, with most roads closed and public transport restricted. Guterres' trip comes with the country in the grip of a drought that has driven many to the brink of famine, while the government is also engaged in a major offensive to put down a bloody terrorist insurgency. The UN chief, who previously visited Somalia in March 2017, is due to hold talks with political leaders and visit a camp for internally displaced people, according to local media reports. The United Nations has launched $2.6 billion appeal for humanitarian aid for the troubled Horn of Africa nation, but it is currently only 13% funded. 5 straight failed rainy seasons in part of Somalia as well as Kenya and Ethiopia have led to the worst drought in 4 decades. While famine would have not been reached in Somalia, the UN says about half its population will need humanitarian assistance this year, with 8.3 million affected by the drought. The UN's Resistant Coordinator for Somalia said last week in Geneva that crisis is far from over. It needs to remain high and urgent.
And back to our dear guest over the phone, Dr. Magdy Adly, Senior Manager in Hospital Management and Quality Control Management. Dr. Adly, back to the main aim of this initiative, which will take place till 2027. How do you see the goals of this initiative?
Okay, I'm sorry for what happened because of
thank
the
you,
weather.
sir.
I see, as I told you, importance of that initiative, that it can prevent outbreak of zoonotic disease in animal and people, improving food safety and security, food security, reduce antimicrobial resistance infections, improve human and animal health. And about the goals of that health approach is, first goal is strengthening multi-sectoral One Health coordination and collaboration between countries. The second goal is development and strengthening surveillance system and data sharing with stakeholders. The third one is strengthening laboratory system and a network to ensure early detection and surveillance and responding to the diseases.
Yes.
The others are strengthening and supporting workforce development to prevent and control the priority of zoonotic diseases. And by the way, zoonotic diseases means the diseases which is transferred from animal to human.
Yes. Dr. Adly, how do you assess the development in the health sector lately?
Sorry, I'm not hearing you well.
How do you assess the development in the health sector lately?
You mean in Egypt or all over the world?
In Egypt.
In Egypt.
Yes.
Look, in Egypt, Egypt aiming at becoming a leader in the field of healthcare service and researches in Arab world and Africa as well. And all Egyptians enjoy a healthy, safe, and secure life through an integral, accessible, high quality and universal healthcare system,
Yes.
capable of improving health conditions through early intervention and prevention coverage, ensuring protection for the universal and achieving satisfaction of citizens and health sector's employee. This will lead to prosperity, welfare, happiness, as well as social and economical development, and which will qualify Egypt to become a leader in a field of health care service and researches in Arab world and Africa. And you can see even what happened in healthcare service in Egypt since 8 years ago through enhancing of infrastructures and improving the qualifying human elements, including healthcare services through continuated medical education.
Yes.
Even the cooperation with stakeholders of WHO and other international organizations.
Yes.
In all levels, even transferring the technology of manufacturing of some vaccine and some life-saving medicine in Egypt fulfill the targets of sustainable plan of 2030. Which keep Egypt in the first in Arab world and in Africa in the field of healthcare services.
Yes. Finally, sir, Egypt is aiming to become a leader in the field of healthcare services and research in the Arab world and in the African continent. What's your take on that?
As I told you, Egypt are working in a right platform nowadays through cooperation and collaboration with other international organizations like WHO and other organizations for rising up the awareness of public health among population and citizens. Even caring with the medical industries for local consumption, and even as exporting that for Africa, because you know we are the gate of Africa. So Africa will be a good market for us if we have if we caring with the medical industries, even a healthcare service, we can export a healthcare service, by the way. And I invite Ministry of Tour to put the healthcare service on the map of Egyptian tour. Because nowadays tour is not only visiting monuments and something like that. Sometimes tours means a health tour, so people come to get services, medical services, and we have nowadays advanced healthcare services and very good surgeries.
Indeed. Dr. Magdy Adly, Senior Manager in Hospital Management and Quality Control Management, thank you so much for being with us and for your precious input, sir. And with that, our dear viewers, we come to the end of this edition of Africa Today. Till tomorrow with another quiz. Goodbye.